All right, on this day, 2 years ago, the World Health Organization declared COVID-19 a pandemic. Here's a look back at that moment and a fresh warning from the agency.
COVID-19 can be characterized as a pandemic. Although reported cases and deaths are declining globally, and several countries have lifted restrictions, the pandemic is far from over.
The WHO says it's not over anywhere until it is over everywhere. More than 6 million people have died from the virus, and there have been over 450 million cases. New variants are still a threat, and vaccine distribution still a major challenge. And to reflect on all of this, I'm joined live now by WHO spokesperson Dr. Margaret Harris, live from Geneva this morning. Dr. Harris, thanks so much for joining us.
It's a pleasure to be with you, Tammy.
First off, a lot of us remember exactly where we were when the pandemic was officially declared by the WHO. Can you tell us a little bit about what the days were like just before that announcement? I know there was a lot of pressure to make that call.
Well, certainly, the announcement was that the level of spread of the virus had led to it now, what we were experiencing being characterized as a pandemic. But the big moment for us was actually the 30th of January, when we declared it a public health emergency of international concern. What was happening in the 6 weeks leading up between those times was increasing calls from us for countries to please sit up and take notice, please take the measures to stop the spread. Unfortunately, that didn't happen everywhere. So then by the 11th of March 2020, we agreed with our epidemiologists and the information from around the world that, yes, this had reached pandemic status.
Now, you mentioned that there were some countries that weren't taking heed to those warnings. Therefore, this is what now the spread was going much further than first expected. And that's kind of the situation now where you're saying as an organization that the pandemic is not over everywhere until it's anywhere until it's over everywhere. It's still the same kind of idea.
Well, indeed. And I mean, we're still seeing 50,000 to 60,000 people dying every week. If anything else was killing so many people in the world, there would be an outcry. And yet people have become numbed to this because it has been going on for so long. But also we're seeing really fresh, big surges. Not everywhere in the world is seeing a decline. In Asia, East Asia, in Korea, in Vietnam, in the Pacific, we're seeing new big surges in countries that haven't experienced this and are really, really struggling. So again, we are very much in the middle of it, and we have to get better at dealing with it and trying to bring the transmission down.
Are you concerned that now that there are so many countries, including Canada, that are easing some of the restrictions and the COVID-19 measures that have been in place, that we are going to be back into a scenario where there would be surges, again, not just in East Asia, but right throughout the world?
We're concerned more about the message that sometimes this lodges in people's minds, this idea that it's over, and this idea that you go back to how you were before the pandemic. What we all need to be doing is looking at what has worked, what has brought the transmission down and enabled us to live our lives as normally as possible while not getting infected. So making the big changes, looking at ventilation, looking at better practices, staying at home when you're sick, employers not insisting that people come into work, looking at being able to work virtually more. All these things are changes we need to be taking very seriously, not just saying, oh, that was during the pandemic, it's all over now. It's not all over, and we need to do a lot better.
Now, the term endemic has been thrown around as well when it comes to COVID-19. Is that somewhere that you think the virus is heading toward? And what is an endemic?
So endemic just simply means that you have a virus in your population that is causing problems. And when you call it endemic, you say, well, you expect this number of cases every year and you expect the same number. So endemic doesn't equal good. I mean, malaria is endemic in many parts of the world. That's not something you want to have. And the difference is if it's endemic and then suddenly you get a big surge, then you get an epidemic. So again, it's not really something you want, but because this virus is so widespread and we've got so much of it, the expectation is it will remain in our population. The the opportunity we may have had at the beginning to push it back into the animal kingdom, get it right out of the human population, has probably been lost.
Okay, great. Again, Dr. Margaret Harris, thank you so much for joining us this morning live from Geneva. We really appreciate you making the time.
It's been a pleasure. Thank you, Tammy.
No problem.